Good morning and welcome to another episode of Coffee and Tea with AARP Connecticut, a conversation in which AARP talks about policies and programs that are of interest to the age 50 plus and their families. I'm Nora Duncan and I'm the state director for AARP Connecticut, and I'm joined today by my advocacy and outreach team, John Erlingheuser and Anna Doroghazi. Today we are going to share where we landed with our priorities in the 2022 legislative session. So Anna, let's start with you.
All right.
Oh, great. Most older adults say they want to remain in their own home if they ever have to receive long-term care. So what are some of the barriers to remaining at home, and did the General Assembly do anything to address those barriers during the legislative session?
Sure. So this was actually a great legislative session when it comes to helping older adults stay in their homes as they age. We know, because AARP does a lot of research and a lot of survey work on this topic, that an overwhelming majority of older adults, if you say, where do you want to receive care if you need it as you age, they say they want to receive that care in their home. In Connecticut, that number is 81% of folks want to receive long-term care at home with a family caregiver or another type of paid caregiver. So some of the barriers to that is who can provide that care. Are there workers available with the skills who can come into your home to provide the support that you need? Cost, of course, is a barrier to finding those folks, paying for them, bringing them into your home. For some people, having appropriate housing is a barrier. If you develop a disability that impacts your mobility, are you going to be able to live in your current home? Is there other affordable housing available in your community? So a few really big wins that we saw this legislative session, where AARP weighed in by talking to legislators, by having volunteers talk to legislators, by submitting testimony to committees. One area that we've supported for years, and we've finally seen some really good movement on it in the last couple of years, is around expanding access to the Connecticut Home Care Program for elders. This is a phenomenal program that is mostly funded through Medicaid, but we also have a state-funded portion for folks who are not Medicaid eligible. And the Connecticut Home Care Program for Elders provides assistance with what's called activities of daily living. So this is bathing, dressing, eating, taking your medication, all of these little tasks that put people at risk for entering a nursing home. But if you meet those needs in the community, folks are able to then age in place. So 2 years ago, the copay for that state-funded portion of the Connecticut Home Care Program for Elders was 9%. And that created a cost barrier for some folks who otherwise would have wanted to pay for that care to live safely and more comfortably in the community. Last year's budget reduced the copay from 9% down to 4.5%. And this year's budget further reduced the copay down to 3%. So we were really excited to see the continued reduction of that copay. This is a program that has always enjoyed really good, strong bipartisan support. And we saw that again this year with this proposal being included in the state budget. Another really exciting program that was included in the state budget this year is a new program that's going to be a community ombudsman program for home care. Right now, Connecticut has a long-term care ombudsman program that provides information, support, and advocacy to long-term care residents who live in institutional long-term care, so nursing homes, residential care homes. Connecticut serves more than 30,000 Medicaid eligible individuals out in the community. We see more and more people served in the community every year instead of in nursing homes, but we don't have an ombudsman program to serve those folks. So the budget this year is going to fund the beginning of that program and fund an ombudsman to serve folks out in the community. So we're really, really excited about that and hope that the program is going to grow in the coming years. Another one that's a little bit kind of wonky, but really important to folks is related to community spouse resource allowances. So basically, when a married individual needs to move into a nursing home, the spouse who stays in the community has to spend down a portion of their shared assets below a certain amount if you want Medicaid to pay for your nursing home care. The budget increases the minimum community spouse protected asset limit from $27,480 to $50,000. The bottom line is that married, low and middle income folks whose spouse is in a nursing home get to keep a little bit more of their money. So those are three programs that were funded through the state budget this year that we're really excited about and are really going to make a difference in people's lives.
Awesome. Thank you. And you know what? It's only wonky if you have to hear about it. It's not wonky if you have to live it. And this is going to double the amount of income you can keep to support yourself and community.
It's important. People are going to feel it,
Yeah.
because if you can't afford it, $27,000, that's fixing your roof and getting a new oven, and then you're out of money. So this matters to folks.
It does. So good. This is a good lead into a question for John. So we know Connecticut is an expensive state to live in. What was passed to improve the lives of residents that we worked on that will help them to be able to stay in Connecticut and, live, work, and play, but especially in retirement?
Well, that's absolutely right. Connecticut is an expensive place to live. And we're in, a time of unprecedented inflation for folks living in this kind of a generation that are in retirement. And so, those are great things that Anna worked on that'll help keep people in the home and community. But something else that will help them stay in their homes and communities is getting some relief in their pocketbook when it comes to paying taxes. And, most people think of older adults as taking more out of the economy than they give in, but we actually know the reality is they give more to the economy in the state of Connecticut than they take out, and the statistics prove that. So we were very lucky to work on three major areas around tax reform that we think are going to have a significant impact, particularly on those middle and lower income seniors in the state of Connecticut. And probably, the biggest one is when it comes to retirement income. Folks in Connecticut already, we've worked on legislation the past few years that began to phase out the taxation on certain retirement incomes. Social Security is already non-taxable for folks making up to $75,000 for an individual and $100,000 for adults. And the phase out for pension and annuity income was also scheduled to continue to be rolled out all the way up to the year 2025. But because of the work we did with the legislature and the governor, that rollout will become permanent this year for the taxable year 2022. So on next year's state income tax, folks making $75,000 as an individual or $100,000 as a married couple will have that fully eliminated. So that's a big major thing that's going to help people stay in the state of Connecticut when they retire. And that's an important thing. And secondly, we have the property tax credit. And the budget takes what was an only $200 property tax credit and expands it to $300. And then provides it to more people. So there are going to be more people in the state of Connecticut that are going to be able to take advantage of that tax credit because it was very limited over the last several years. It was much more expansive and even more than $300 in the past, but we got it back up to $300 and we broadened the spectrum of people that will now be eligible to get that tax. And then finally, probably one of the most inequitable taxes in the state of Connecticut is the car tax. And we work very closely with the finance committee and the administration to get the amount of taxation on cars to be lowered. And probably what's going to reach between 70 to 100 municipalities in the state of Connecticut, where the mill rate will be reduced from 45 mils to 32.46 mils. So that's basically, the amount of money that they're going to pay in those towns that have mill rates over 32.46 mils, a significant reduction in their car taxes. And that's important for people. I live in the smallest city in the state of Connecticut, Derby. We pay over almost 39 mils in property tax. This is going to significantly help reduce the car tax in cities and towns across the state of Connecticut. And, that's a very inequitable tax when it comes to people that are lower and middle income. So a tremendous amount of tax relief. Overall, there's over $600 million in tax relief in the state budget. And the taxes that we're talking about are permanent tax cuts. So those things are going to be important to the individuals that we care about. And along with the programs that Anna worked on, we think we're going to really contribute to kind of that drain of our older Americans out of Connecticut and down south, because we have a lot to offer in the state of Connecticut. And now we're going to make it easier for them to keep more of their hard-earned dollars in their pockets.
Right. Thank you. Yeah, we want to see more people stay here with their families, more people move here, and this really will have an impact on folks. So, Anna, let's change gears. According to the Coalition for Elder Justice in Connecticut, approximately 1 in 10 older adults experience some kind of abuse every year. and a lot of this abuse goes unreported. So what did the legislature do to address elder abuse this year, and what didn't they do?
Sure, that's a good question. And you raise a really sad statistic that older adults experience incredibly high rates of abuse. And it's a form of abuse that we don't tend to talk about a lot. So what the legislature did this year, there were two pieces of legislation that AARP Connecticut supported that we were excited to see pass. One was around the deadlines for mandatory reporting for suspected elder abuse. Currently in Connecticut, if you are an elder abuse mandated reporter, you have 72 hours to report the abuse to the Department of Social Services. That's more time than we give for child abuse, for example. So in recognizing the fact that elder abuse is serious and that we need a quick turnaround time, we're lowering the amount of time that you have to file a report from 72 down to 24 hours. The same piece of legislation, if you're a mandated reporter of elder abuse and you fail to report the abuse in that new 24-hour window, you are going to be required to retake your mandated reporter training. Which leads me to the second bill that we supported on this topic, which is training for mandated reporters. So it can be hard to spot the signs of elder abuse and neglect. And for professionals who work with older adults, it's really important that they have the skills and the information they need to identify this abuse when it occurs and to have an understanding of how to respond appropriately. So a bill that passed, House Bill 5313, among other things, it requires mandated reporters to complete the Department of Social Services elder abuse mandated reporter training or another approved program within 90 days of becoming a mandated reporter of elder abuse. There are a lot of other pieces to that bill. There's also a piece that we supported that requires the Department of Social Services to notify Medicaid long-term care applicants of some of their legal rights related to that application process. Even though there were, a lot of things in that House Bill 5313 that did pass, there was a piece that got taken out in the process that I think would have been really helpful, that would have reduced caseloads at the Connecticut Protective Services for the Elderly. So this is the piece of state government that really takes the lead in responding to elder abuse claims throughout the state. There was an audit done of that program in 2021 that found, among other things, that some of the social workers within that program have caseloads of 70 or 80 cases. This legislation would have set a cap on that caseload of 25. And we were really excited about that proposal, but it ended up being unsuccessful and did not pass. So that's something that we hope will come back in other sessions, because we know that if you have these big caseloads, you're not giving each one of these cases the time and attention that it deserves. So more resources there in the future would be really helpful.
Yes, it would be. And, the caseload issue will continue to be a topic of conversation as we move into 2023. Obviously, it means probably hiring staff, and we got to see where the administration lands on that come next legislative session. All right, John, speaking of administrations, we are facing an election year. It's 2022. It's the midterm elections if we're talking about our federal elections, but actually, every constitutional officer, all of our General Assembly, they're all up for election this year. There's some really important things happening. So what are some of the things that passed to help improve the voting experience for residents of Connecticut?
Yeah, Nora, that's a great question because, voting is not a privilege. A lot of times people say voting is a privilege. No. In the United States of America and in the state of Connecticut, voting is a constitutional right that's guaranteed to you. And, we at AARP believe, really that we should do all we can to expand people's ability to vote and to have the ability to vote and participate in the process in as easy and as convenient way as possible. And so we want to do as much as we can to promote maximum participation in the process. And, we did do that for the last several years, starting with the 2020 election when the pandemic started. And, Connecticut had a very restrictive process to be able to vote by absentee ballot. And you had a very prescriptive way that you had to choose from in order to be eligible to vote for absentee ballot. So, for example, you had to be serving away in the military. You had to be out of the state of Connecticut from 6 a.m. to 8 p.m., the entire hour of operation of the polls. You had to personally be sick yourself and incapable of getting to the polling location, or working at a polling location other than your polling location. So those were just kind of some of the very few options you had to vote absentee ballot. Then with the pandemic and before vaccines even, people wanted to be able to exercise their franchise. And so we worked with the legislature to pass temporary legislation to expand people's ability to vote by absentee ballot, because using the pandemic as an excuse. So interpreting that, a sickness meant not just your personal sickness, but your fear of getting sickness. And we were able to do this and extend this protection several times throughout several elections. And what we saw with that extension was that participation in the process increased. More people voted by absentee ballot. And our members and older Americans really availed themselves of this option in a way that we had never seen before. And we had record participation by absentee balloting. And it's something that people have told us and said they wanted to see continue. So we worked on a piece of legislation this year, House Bill 5262, that would allow for more expanded options to vote absentee ballot permanently. And basically what we did is kind of mirror the language of the state statute to the prohibitions in the Constitution for voting absentee ballot, which are more expansive in the Constitution than what the previous statute was. So now, sickness could mean not just your sickness, but for those caregivers out there, it could mean that there's a sickness for a loved one, a child, a parent, a significant other that requires your attention. And because you're caring for them and their sickness, you can now vote absentee ballot. There could be a public health emergency like we're currently still in with COVID that could say, hey, you know what, I don't want to be standing in a line in a crowded polling location with privacy booths that are facing one another. I want to be able to vote absentee ballot in this public health emergency. It also said that now if you're out of town at any hours during the day of polling operations, you're now eligible to vote by absentee ballot, not the entire 6 a.m. to 8 p.m. So this is great for folks, particularly, who commute like me. I commute an hour to work every day, right? I mean, and there are people who live in Fairfield County who commute to New York and they take significant hours out of their day just to get to work, let alone the 8 to 10 hours they put in a day at their job. So, this is going to be a tremendous opportunity for folks to take advantage of absentee balloting. And this is in effect for this upcoming election. And so, we have a tremendous amount of resources and information we can get to folks about how to avail themselves of absentee balloting and everything else. And I think this is just a great leap forward, and we're really encouraged by it.
Yes, and I will give a shout out for that page, John, that we have all of the information about how to vote in Connecticut, what the new rules are, what ballot questions will be on the ballot, about primaries, etc. It is aarp.org/CT votes, and that is available in Spanish as well once you click there. So we encourage people to check that out. We've had a couple little changes in polling places as well, so people can check on that. But that gets updated in real time. So people should definitely check it out. Again, it's aarp.org/CT votes. So I'm going to go back to Anna and switch gears again, because we do have a lot of priorities at AARP. And one of them is lowering the cost of prescription drugs on both the state and federal level. Anna, in Connecticut at the state level, were there any bills that would have lowered the cost for consumers, and what happened with those pieces of legislation?
Sure. So there were two bills that we were interested in this legislative session. One would have created something called the Prescription Drug Affordability Board, which we lovingly refer to as a PDAB. And what a PDAB is an independent body that's established by the state that evaluates prescription drug prices and sets limits on how much certain payers, like insurance companies or state government programs, can pay for certain high-cost prescription medications. We've seen this legislation go into effect in other states. Maryland, Colorado, New Hampshire's in the process of creating rules and regulations for their program. And we thought that this would have been a really great way to, first of all, get some information about what are the high cost drugs in Connecticut, and then to act on that, to say, these are inappropriately high prices and insurance companies can't pay these prices anymore. We have to lower the price to something that makes more sense for consumers. Unfortunately, even though we had a really strong coalition of folks who were involved in pushing for this legislation, it did not make it across the finish line, but we are hoping to circle back and work on this bill again in 2023. Another bill that's been around in Connecticut for a few legislative sessions now is related to Canadian drug importation. The idea here is pretty straightforward. Basically, it would allow it would allow Connecticut to submit a plan to the federal government detailing how Connecticut would safely engage in wholesale importation of lower cost Canadian prescription drugs. Prescription drugs in the United States cost a lot more than pretty much anywhere else in the world, including in Canada. I've talked to folks who have said, I can't afford to pay what this drug costs at a Connecticut pharmacy. So I drive to Canada. It's not too far away. A Canadian drug importation program is a safer, easier option for folks. It's a lot better regulated than buying cheaper prescription drugs off the internet, for example, which is another thing that we know folks do when they can't afford their medication. This legislation, again, had great bipartisan support when it went through the committee process, but it ultimately didn't cross the finish line. So we're disappointed that we didn't see real reforms, in either of these ways this year. But prescription drugs, as you said, really is a top state and federal priority for AARP, and we'll be back at it next year.
So anybody running for office in Connecticut, pay attention. We will be back on that next year, and we're not giving up. So
yeah,
make it a priority.
We'll talk it through.
Make it a priority. All right, John, I'm going to have you quickly wrap us up. Just give us a quick overview on the gains and the disappointments around utilities and telecommunications this session.
Yeah, so the good news on telecommunications is that there's a tremendous amount of federal dollars coming in the state of Connecticut from the American Rescue Plan and the bipartisan infrastructure bill that dealt with, included in the term of infrastructure was the build out of high-speed internet, sometimes referred to as broadband. And we have a tremendous amount of people in the state of Connecticut that are either unserved by high-speed internet. You think about the rural areas of the state of Connecticut, or they're underserved, the inner cities, where the internet companies weren't going because it's not profitable to them either to build out, hundreds of miles for just a small number of people, or in the inner cities where there's more low and moderate income folks, and it wasn't profitable to them kind of have a secure infrastructure. But we know internet is important because it's essential for telecommuting. It's essential for virtual medical visitation. It's essential for being able to communicate with loved ones that are in an institution or live miles and miles away, your grandchildren and so forth. And what this federal money has been allocated to do is kind of address those issues. So, it's going to actually help not only with bringing internet to the places where it's unserved, but it's going to bring it to those that are underserved. And a lot of that money is going to go towards building out from the poles out in the street to the homes, so that a lot of low and moderate income folks are going to have the ability to get access to that internet. And so that's critical. And I would be remiss if I didn't mention there is the Affordable Connectivity Program that allots $30 a month to individuals to pay for internet service. The president recently announced that 80% of the internet companies are going to price a plan that's a good plan at $30. So, people are going to have the ability to get free internet service in the near future. So that's encouraging. So that's really great news for folks. We've been waiting for this for years, and I'm glad it's finally happening. On the downside, we've done a lot of work over the years on consumer protections as it relates to third-party electric suppliers, and we've put a lot of guardrails and bumpers around them. Not enough yet, but what we built is pretty strong set of consumer protections. We're running into the same kinds of problems, though, with the solicitations of the solar companies. And, solar is a very good product. I don't see as much value in third-party electric suppliers, but when it comes to solar companies, there is value in solar. And it's not a market we want to see go away. We want to make the solar market work because it's important for people to be able to save money and important for the environment. So we want to make sure that the solicitations around solar are done in a clean, transparent way, and that the companies that are hired to market those solar programs are doing it in a way that's fair to consumers. Unfortunately, we had a bill, second year in a row we had a bill. The good news is we got the bill out of committee this year. We didn't get it past that, however. It was Bill 5326. We're going to go at it again next year, and we're going to try a different tack because, unlike the third-party electric suppliers who are just selling a contract for a product, when you buy a solar contract, you're actually getting into a contract like you are with somebody building a home improvement on your home, because they're actually constructing solar panels. So it cuts across more departments within the state of Connecticut, particularly the Department of Consumer Protection. So once again, that's an area where we'll be back. We want to work with the industry to try to come up with something that'll be workable for everybody.
Great. Thank you so much. Just to let everybody know, on our website, we have a post up about all of the wins with links to all of the pieces of legislation, budget implementers that we've talked about today. So aarp.org/CT. You'll find that there, plus a lot more, plus the links to our events where you can join us for free for virtual and in-person events around the state, and joining our national team for events they put on as well. We invite you to take part in that. Anna and John and our volunteers on our advocacy committee, thank you very much for a successful 2022 legislative session. And again, I hope candidates for office and legislators are watching this now, because you know what we'll be back for, and what's important to the 600,000 AARP members in Connecticut. And with that, I will close up. Thanks, everybody, and have a great day.